My name is Dr. Chibuzo Anaso. I'm a general practitioner for 10 years and the CEO and founder of AnasoDiabitiz. Every day in my practice, I have to deal with patients who have diabetes, and the management can be, it poses some peculiar challenges. We need data from patients on a daily basis in order to give them the best of care. This can be troublesome, this can be disorganized, and in most cases in Africa, it is not done for the detriment of the patient. So I'll tell you a little story. This is Olwetu, a 5-year-old diagnosed of diabetes. The mom was close to tears as she described their ordeal. And for me to manage her properly, 5 aspects of care needs to be optimized, which is education, healthcare team management, self-management, support, and monitoring. So for education, I give them some basic education during the consultation. To extend this beyond the consultation, I actually built a platform for my patients who have diabetes. So I have in there a section called Diabetes 101, which gives them a crash course on diabetes. And because Olwetu will need to be seen by other healthcare professionals like a dietitian, diabetic nurse, I help them find them. So they can go online and search for a healthcare provider, and online they are able to add them and request to be part of their management team. They're able to control the interactions and reminders with the healthcare, those healthcare providers. And for me to manage Olwetu properly, I'm gonna need data on a daily basis. So to help them do that, I created a dashboard for them where they can log various readings. So, for example, they can log the blood sugars daily, and this is the form that they use to log the readings. And if one reading is out of place, I get an alert. So, and we know that support groups has been playing a major role in the management of diabetes. It's a place where people who have diabetes help and support other people with diabetes. Unfortunately, they meet like once a month. So to extend that functionality online, I've created a social media where the physical members of the support group can register online so that the interaction goes on 24/7. Now, before 2 weeks later, for a follow-up visit, all I needed to do was to log in to my dashboard, look at the readings, these actual patient data, so I've taken out the identifying factors, get the analysis, and this tells me where the problem is, which gives me tailored solution or tailored answers to their problems. So, Olwetu is just 1 in 4 million people in South Africa living with diabetes. 1 in 50 million people in Africa who have diabetes. And last year, 4.8 million people died globally on account of diabetes, of which 50% are less than the age of 60. On our satellite practice, I tried to enroll some people, but unfortunately, because of poor internet penetration, I was unable to. So I designed the SMS portal for them. Can I have the Elmo, please? So for example, I send the word diabetes to that number already saved, and I also designed a kiosk, a self-management kiosk, which will interface with your blood glucose machine, with your blood pressure machines, so that this data can be updated by just plunking into that kiosk. So the interactions I've showed online can also go on via SMS. So I started getting requests from patients to use the platform to manage other conditions like blood pressure, for obesity, and some patients were like asking to use it to other patients enrolled and then got their doctors to sign on, and we got requests from doctors. So we had to make the platform available. Recently, I got a request from the Medical Research Council of South Africa to conduct a study on this platform. So that made my life easier initially, but later I started losing sleep dealing with this request. So I built a team of finance, of someone in finance, someone in marketing, and we're about to sign 3 major advertisers because it's important for our users to keep using this for free. So we provide them the users, they have products for diabetes, and then they can advertise to them. So what I'm here for, I'm looking for investment because we want to put this kiosk in every community in Africa. It's an awesome opportunity to make people healthy via a sustainable model. Thank you. I'm Dr. Anaso.